Tobacco Day, which is observed globally on 31st May. And I thank each one of my colleagues on a Saturday morning. It's absolutely busy, but your presence shows the collective commitment we have for smoking cessation. In a simple question, I will like to start with. So, how many lives can we save, because of this tobacco issue? And we know that it causes cancer. Cancer is the second leading cause of death worldwide, 9.7 million. And we all know what is the first cause of death? Heart disease. So both top two reasons of death caused by tobacco. And the most deadly risk factor, which is preventable, modifiable risk factor, is tobacco. And unfortunately, India is the second largest producer of tobacco and second largest consumer of tobacco. Almost 1/3 of Indians consume tobacco in some way. You'll be surprised to know 1/3 is smoking, but 2/3 is smokeless tobacco, which is gutka, kheni, and some people think that smoking only causes cancer and all these bad side effects, but the gutka, the smokeless tobacco, we call it SLT, is equally bad. And today I want to take this platform as an opportunity to really condemn our celebrities and even sports icons which are shamelessly giving ads and working in promoting the gutka ads on the TV. I think there should be they should have some integrity. So definitely gutka is not the way to go, and that is not a form of refreshment. But all said, there is hope. As per recent survey, 30% of men between the ages of 35 and 50 are actually trying to quit. So it's not that every smoker has this thing that the thought never comes that I'm going to quit. They definitely want. But why it is so difficult to quit? It's not the game of only willpower. It needs access. It needs some support, constant hand-holding, and guidance. So I just want to reiterate a fact which I didn't make up. When you have a physician-assisted quitting, it increases your chances 6 times to quit. But definitely, the willpower starts from you, and definitely a supportive family. With that, I welcome you all, and it's a collective effort, and the community has to have awareness. So the whole point of addressing today is to spread awareness, education, and to know that there is help available, and we are here to help you. Thank you so much. With that, I'd like to hand over the mic to Dr. Nayak, Dr. Sandeep Nayak. He's the Director of Surgical Onco in our Fortis Hospital, and I can't even count how many cancer-related surgeries he does. So over to you, Dr. Nayak. Please give us some words of wisdom and your thoughts, share your experience.
Thank you. Good morning to all.
Good morning,
sir.
Today
is, as Dr. Shalini told, it's World No Tobacco Day, and the intention of having this day is to create one awareness among people about the harms that tobacco causes. Because there's one day where we don't advertise tobacco, rather we advertise against tobacco. Rest of it is for the government to earn money. Today is the day when they think of losing it. So that is the reality of life. So do you know what is what is the unpreventable or unavoidable cause of cancer or any chronic illnesses? Not preventable. Anybody can raise their hands and just tell me.
And they'll get a prize for answering that. I have tons of prizes.
Okay, she has prizes, so it's my first question to the audience.
Yeah,
Unpreventable, irreversible cause of cancer, I'm asking. Because it's a very important. Irreversible, which cannot be reversed, which cannot be avoided.
That's a tough question for the day.
No, because it's very important.
No, unpreventable cause of cancer.
A cause that you cannot change.
Leading cause of cancer.
Welcome, Dr. Rajpal. This side.
No.
Dr. Rajpal, please, this side.
That also is preventable. It is age.
This side.
You cannot reverse it. age is something which just progresses, and it, as you get older, damages accumulate in the body, right? So that damage cannot be reversed. But what you can make worse is by adding other things like tobacco. You can add many other things, unhealthy habits. You can add alcohol to it. So all these things can only increase your risk of cancer. Tobacco actually contributes to about 70 to 80% of head and neck and lung cancer. 70 to 80%.
India has the most head and neck cancer.
Yeah, and some states of India have about I think say take UP, Bihar, and all these states. About the 40 to 50% of people are smokers, tobacco users. So the load of cancer is very high in those regions. South India is not less. We have about I think 30 plus percentage of population which uses tobacco. So, and also alcohol also. In fact, something which we generally tend to ignore. Alcohol is also one of the known causes of cancer. So anything that is addictive, anything that is good is bad. Let's
Any food which tastes good is bad.
Yeah. So generally you have to keep that in mind. So indulgence into anything that indulges you have to be cautious about. So that is a key message, and with that I think another important thing to remember is see Dr. Shalini. I've seen her for about I think 8 years or so. I'm seeing her dedicatedly working for tobacco. She has always I'm sorry. We both made the same mistake.
Absolutely.
Okay.
We are so excited.
Yeah. So reducing the tobacco caused harms in the society. So it requires dedication because it's a thankless job, literally. Because you don't get anything out of it. But it's very, very, other than satisfaction, of course, that you have done it. So that is, that dedicated, work towards it is what is very important. And I wish Madam the very best to really start this again and take it to higher.
So the mic goes to Dr. Sachin Baliga. He is the one who's going to make a difference, and he is the inherent partner in this because he's a psychiatrist. So he will do the behavior change. So please take it away.
Yeah, I think the only thing that I would like to talk of with this opportunity is to touch on the aspect of vaping, because vaping is something that had still not got the discussion openly when we talk of tobacco related problems. We these days see a lot of individuals who by themselves, like ma'am said, there are a lot of individuals who realize that okay, smoking is becoming a problem for us and we need to deal with it. And as a result, from some information that they get from somewhere or from Google Mata, like we say, they turn towards vaping as a solution to it because they think that that will not be problematic for them. Now, there are certain reasons why vaping is a good idea, but there are a lot of reasons why it is a bad idea. The good thing with vaping is that when you are trying to stop your cigarette consumption, you want something that feels like that, which looks like that, will give you the same kind of a smoke. So it becomes a very relieving thing that you have something that you can smoke instead of all these nicotine related chewing gums and lozenges that doctors will talk of. The other good thing about it is that unlike tobacco, which has a lot of 5,000 to 7,000 other kind of chemicals which cause cancers, ulcers and body damage, vaping doesn't have those things because it specifically has only nicotine in it and not those other problematic chemicals that are a part of tobacco plant itself. Now the problem that comes is when you smoke, you know how many cigarettes you are having. But when you vape, you don't know how much you are taking. And a lot of individuals, when they shift to nicotine cartridges, they end up smoking a lot of amount of cigarettes that they would have actually, because the amount of nicotine they consume within a few days is much more than what they would have if they were smoking normally. The other problematic thing is that there are areas where smoking is prohibited, so someone can smell you. Vaping has no smell. So you will have people who will have one vape in their car, one in the washroom, one in their bathroom, one in the office. Between meetings, they'll have a couple of puffs and they'll keep it inside, and nobody comes to know. So it is such a nice stealth mode, that people end up becoming addicted to vaping as a result. And these things apart, the entire mechanism by which vape is created, the gas that is generated, had certain harmful chemicals like formaldehyde and propylene, which actually cause lung damage. And there have been numerous reports of teenagers, young kids who are practically collapsing because they cannot breathe in a lot of places because they get sudden lung-related conditions, allergic pneumonitis and those kind of things. So definitely if somebody suggests to you or you find out from somewhere that, oh, you are addicted to smoking, maybe you should shift to vape, that's not really a good idea. And like ma'am said, a better idea is you consult a physician and discuss so that you can, with a good amount of partnership, work over it with determination and get over it.
Thank you so much, Dr. And the mic goes to you. Dr. Rajpal is our senior cardiologist. Please share some.
So apart from cancer, one leading cause is also COPD. So I've seen my father developing a COPD because of smoking.
Absolutely.
So that
you're
also.
absolutely right.
Yes, there is a big list of things which smoking causes. So
And if we start about harmful effects, we will have a whole day.
Sure.
So
in
we
fact,
will
all
just
specialists
go.
can talk.
Yeah, I think no part of
We will
body
do,
is
we will do
efficient.
quickly because we have to get on to. I don't want anybody to be waiting for their treatment.
Well, thank you, Dr. Shalini, for asking me to talk here. Basically, I wouldn't have peripheral in practice in India if there were no smoking. It's as simple as that. 30% to 40% of the patients I treat, particularly the young ones who come in with heart attacks, who come in with coronary artery disease, are smokers. And there is no two ways about it. It's one of the most significant risk factors. And this is not difficult to stop, and I can tell you this because I'm an ex-smoker. I smoked for nearly 20 years and I stopped, and today I'm a cardiologist and I can tell you it's not difficult to stop. One of the things that I tell my patients when they come in with a heart attack is put the cigarettes on one side of the scale, put their life on the other side, and see what weighs the most. And it is very important, particularly with coronary artery disease, with cancers, and with other things added on to it, hypertension, be it peripheral vascular disease. All of these has got an important impact on your life, not only how long you live, but also the quality of life. So this is the time to put your hands together and stop smoking, and there's no better day. Today is the day. You just have to decide that, look, I'm going to stop smoking today. And a vast majority, nearly about 80% of my patients who come in as smokers go back as non-smokers. And one of the first things that they get when they come for a follow-up appointment is, do you smoke? Are you still smoking? And they get a barrage of questions from me, and some of them get told off as well, and a vast majority of them do stop. So all clinicians here would stress upon the fact that smoking is not good, whether it's the heart, whether it's the lungs, whether it's the cancer, and infertility. The women who smoke have got a higher incidence of infertility. The men who smoke, this doesn't work. So it's very important that you take this on board.
Okay. Thank you so much. Dr. Singhal is a senior neurologist. Would you like to share a few words?
Thanks, Dr. Shalini. So, as a neurologist, we see quite a common young stroke nowadays, and directly or indirectly, I think 50% causation is related with the smoking. Okay, so along with that, if somebody has diabetes and hypertension and they smoke, it is not like additive; it is multiplying effect. So they cause a lot of peripheral neuropathy, peripheral vascular disease, end up in amputation, stroke, which is means. Most of the time stroke, if somebody dies, is good for them, but those who survive, bedridden and all, is very painful for the family as well as the patient. So I always tell them, anybody who is my patient, so we have Nimes, I was there earlier, we had rehabilitation ward in Nimes. I tell them patient who, most of people feel, oh, it will not happen to me. So I tell them, okay, you spare your 1 day time, go sit in Nimes 1 day and then come back to me. Most of people though go to there, and they realize that, okay, life is very difficult after they have a debilitating stroke. So my concern is that anybody who is smoking, and not only active smoking, even passive smoking is very harmful. So we always tell, see, if somebody is smoking, has stroke, it is his duty, he has to stop smoking, as well as his nearby friends, relatives, all, he has to pursue them to stop smoking. Okay, so always tell the person, those who are smoking, those who are, my friend is smoking, at all, he's not your friend, he's your enemy. You have to throw him out. So that is my experience.
Thank you so much, Dr. Gayatri Kamath is a senior gynecologist nephrologist, would you like to say a few sentences regarding the harmful effects of smoking?
So at the outset, I would like to congratulate Shalini Joshi for having taken this initiative. All of us are worried about smoking and the side effects, but taking this initiative was amazing. All the very best.
Need your
And-
support.
Yes. Now, earlier I would think that women don't smoke. This was about 20 years back. I'm seeing more and more women smoking. So I'm equally concerned being an obstetrician, and as some of our colleagues mentioned, side effects include infertility and multiple problems. So I think we all know that smoking is a strict no, and taking help from healthcare practitioners will definitely help. I have some of my husbands who have been very kind enough to say that it was only because of Dr. Shalini we managed to quit smoking. So thank you so very much.
Thank you so much. Dr. Atra, would you like to say 2 sentences? We are running short of time.
So this is a judgment-free zone. Those who come here already know smoking is bad. So they'll help you identify why you pick up the smoke and help you deal with it. So you want help, please reach out to us.
Dr. Atira is a robotic hem-onc head and neck surgeon, one of the few ones in India. And next to him is Dr. Chandan, who deals with ICU patients.
I look after very sick ones, and a significant proportion of our patients are smokers. And smoking is one of the highest risk factors, and I look after all the specialty sick ones in my ICU. If you smoke, you are more likely to die if you come to ICU. That's why I'll end with that. So we'll say no to tobacco.
Thank you so much. Dr. Ashish Parekh is our senior nephrologist. Please share your thoughts.
So, like other organs, kidneys are also affected by smoking, and especially people who are hypertensive, diabetics. The rate of decline of kidney functions and tendency to develop kidney problems is much more in patients who tend to smoke. Definitely, giving up smoking is a good idea.
Thank you so much. Dr. Mohan Putteswamy is the person who fixes the bones, and he'll tell us what are the problems in bone healing when a person is a smoker.
Tobacco affects every organ, not just bones, osteoporosis, all of these things are there. But I think more than the organ, we have to look at deglamorizing tobacco. So I think most people start off in teenagers for glamour. And the second thing is going to be, they say it is de-stressing. I think both of these are bad arguments justifying tobacco. I think the move is to take away the glamour, and you have to look at the reality. So the ugly face of tobacco is printed on the packet, but people ignore it. I think this initiative is to look at the ugly face and recognize that face could be yours.
Thank you so much, Dr. Mohan. Now, adding to that thought, today's WHO theme for this year is unmasking the wheel, exposing industry tactics on tobacco and nicotine products. So they are very fancy. Oh, here is Dr. Nisha. We will get back to Dr. Nisha, but before these 3 main doctors who are there, Dr. Santosh, who diagnoses all the cancers in the X-ray, very important. And next to them is Dr. Uma and Dr. Sunil, who will actually give us the diagnosis of cancer. So, Dr. Santosh, would you like to say 2 sentences?
Yeah, I think nobody spoke about screening for lung cancer. I won't speak about the bad effects of tobacco. I think all of us have enough, spoken about enough about that. The US Preventive Task Force, as all of you know, is already running a program which is well documented for people between 50 to 80 years of age who are currently smoking or who are quit smoking, or I think it is about 20 back years or something. So all these people have had low dose CT for diagnosis of cancer, and that is what is recommended for low dose CT. This is of course not a established program in India, but I think I would ask Dr. Shalini, maybe we can look at screening programs for lung cancer. So presently, I think the screening program for lung cancer is only based on a chest X-ray and a sputum cytology, which of course is not very sensitive, but we can,
Low dose
we can probably look at it as a starting program for lung cancer.
Thank you so much for your support from the department. Dr. Sunil, would you like to say 2 sentences? We have to do the inauguration.
Yes. So as Dr. Santosh was rightly telling, the screening programs I feel in India are a little lacking. So there may be, I think what is required is more awareness and more screening initiatives have to be taken. Because I think not only the active smokers, there are a lot of passive smokers also in a family who are always exposed to the smoke. So maybe we should initiate, because the rate of cancer is increasing dramatically in India, which we see regularly, the biopsies, and it is almost 10x from what we were seeing before few years. So definitely screening initiatives and more awareness, maybe discussing about more tumor markers when any new patients are coming. So that is the way forward now for us.
Dr. Nisha, please come over here. Thank you so much, Dr. Sunil. Yes, you have to speak. You are the latecomer.
Yeah. So I don't know what everybody has already spoken. So
Everything.
I don't,
She is the
that's
one
what-
who treats.
Two
sentences.
Two sentences. So yeah, no, more than that,
She is a
want-
cancer radiation specialist.
Yes, I am an oncologist and I see all kinds of cancers from head and
And she
neck
treats
to
them.
lung, and yeah, I treat them. And mostly we get some patients for whom surgery is not possible, or we treat as an adjunct, like the radiation oncology department. So some of the cases that comes to us are really very bad, very advanced and all that. So one thing that whenever I go for talks and all, that people ask me, that maybe most of them might not have spoken about this, people always say that my grandfather used to smoke for like 40-50 years, but nothing happened. So this is a very rampant question, and there is always that one lucky grandfather in everybody's family who has been drinking, eating whatever they want and had nothing. So just wanted to tell the answer to that question as to what we should think at that point of time, is that the gamble that you are taking, when you smoke, it is 8 times that of a random cancer that you can get when you live clean. We all are living in a cesspool of pollution, polluted environment and all, and we do carry an average risk, a small risk of carrying cancer any which ways. But this is catapulted to 8 times when somebody smokes, and hence what is a gamble you would prefer when the probability of you dying is 8 times more, or 1x. So I think that is a valid, and is it something new? Yes. So I think I have made my point, and 2 minutes is over. Thanks a lot.
I'll take the mic.
Thank you.
Well done.
Thank you so much. And with that, I would like Dr. Sandeep Nayak to unveil the relaunch of smoking cessation, in fact, tobacco cessation clinic. And we are focusing here, offering help to quit. And it is not only for patients, it's for anyone. Like Dr. Rajpal said, it's for anyone and everyone, family members included, junior doctors included, patients, their relative, friends, nears and dears. So with that, I would thank everybody once again for being here today on a Saturday morning. This is really special to my heart that all of you came today. It's a very busy day. And you all have patiently listening, and you didn't come here for a checkup, but I hope it added to some knowledge, and you would encourage your near and dear ones to seek help, assistance in smoking. All doctors are there to handhold you, to guide you and to support you. Thank you so much.
Thank you so much,
Dr.
ma'am.
Nayak, thank you.
I mean, it's really a privilege and honor for all of us to have all the senior doctors.
Please come over here,
senior. So it's good morning,
Introduce
everybody.
yourself. What would be your name?
My name is Rajiv Datta. I'm a chartered accountant and company secretary.
Okay.
I work for the Tata Group, and it's a real pleasure. I mean, it's a privilege for all of us as patients to have all the senior, heads of departments coming over here and really guiding us. And actually, it's a no-brainer. See, we all know that cancer causes cancer. I mean, tobacco causes cancer. But people don't look at the obvious. It's very simple. Whether we sell our car or a house at a loss, we'll not do. So we are using our brains. When it comes to alcohol or tobacco, we fail to use our brains. So I think this is one of the things which I've picked up. My father was a smoker, he was an alcohol, and apart from just a cancer or a COPD, it also leads to thickening of the arteries. I do a fair bit of studying for health as well, though I'm a chartered accountant. So, and it leads to coronary artery disease, obviously. It leads to higher LDL levels. It leads to kidney dysfunction, and finally it leads to higher causes, higher chances
Have
of.
you thought of switching your field to medical field?
Yeah,
We welcome you.
So I always.
You can actually come for the helping handholding.
So after what I thought after retirement, I'll enroll for.
A big round of applause. So, I didn't get your name.
My Raju Dara. I work for Tata Consumer.
Thank you so much for.
Thank you for providing.
Thank you so much. Sir, you have to just open it. Or we can, shut it. No, here.
Please join.
Yes. Yeah, here. Okay. You want to open this also, sir? This is the thing. Last picture, and you can all get back to your patients. Please come, everybody. Dr. Raju.